Good morning, everybody. Welcome to our online session of today, a special Pink October awareness segment. We are very fortunate this morning to have a team of experts that are going to share with us what is the care gap in treating breast cancer. I'm your moderator today. My name is Dr. Simi Hong. I'm from Breast Surgery Unit, Department of Surgery. Today I will be the first speaker. And I'm going to show you what is the global impact, global and local impact of breast cancer. So let's look at what we have today. So today I'm going to share a little bit on this. In managing breast cancer, we have a lot of care gap. As what we know, in 2020, breast cancer has become the most commonly diagnosed cancer in the world, and it already overtaken lung cancer. And on estimation, 2.3 million of new cases has been diagnosed, and 685,000 deaths occur in 2020. And as what we know, breast cancer is the most common cause of cancer death in our women. Let's look at the cancer among women worldwide, and we can see here there's different types of rate we can see, and Malaysia, you can see, is about 47.5 out of 100,000 population that registered to have newly diagnosed breast cancer in 2020. And the whole world, we have 2 million cases of new cases diagnosed during that year. And female breast cancer have surpassed lung breast cancer. And these 2.3 million new cases in our worldwide, we can see breast cancer is already involved 11.7%, compared to other cancer such as lung 11.4%, colorectal 10%, and stomach 5.6%. And breast cancer remains the fourth leading cause of cancer death. And how is the breast cancer prevalence in Asia? Is it different? So we can see here in Global Can 2020, breast cancer are the half of the cancer worldwide, and which is the second commonest cancer as well in Asia. And you can see we have 1 million of breast cancer, newly diagnosed breast cancer in 2020, which is 10.8% among all the cancer. And you can see our survivor is quite low comparatively with other countries in Europe. And this is the 5-year relative survival diagnosis of breast cancer registered in MyScan 2018. You can see Malaysia, the survival, 5-year relative survival is only 66.8%. And we also can see stage 3 and stage 4 breast cancer is higher among the Malaysian women. So they present late. And you can see the lifetime risk here. In 2012 to 2016, 1 in 27 of women will be diagnosed with breast cancer in Malaysia. And our survival for 5 years is only 66.8%, which is very, very low. So why are women with breast cancer present late in Malaysia? We have a research study done under Cancer Research Malaysia, as well as Hospital Tunku HTAR, we call Hospital Klang. You can see here that's a lot of barrier in help seeking of Malaysian women when they present with symptoms of breast cancer. So the objective of the study actually to interview and get what is the reason the patient came late. So the patient involved in the study is stage 3 and 4 disease, and they found the barrier across the cluster is poor knowledge, first thing. Second one, the help-seeking behavior is another problem that we found. And we also can see there's a lot of delay reported as poor motivation, fear, embarrassment, and lack of social support. And this is the summary of the cause of late presentation by the study. And because of this, today we are going to have a 4 panel of speakers is going to share with us their project in how we can create a good early diagnosis ecosystem. Yeah. So our second speaker, Professor Noor Aisha Muhammad Taib. She's a senior consultant breast surgeon and professor of Department of Surgery in University Malaya since 2012. And currently, she's the head of Cancer Research Institute, which is from 2019 until now. And she has published 234 publications in peer-reviewed journal with a H index of 36. And currently, she's the local lead in the Greater Petaling City Cancer Challenge application and City Executive Member and Technical Committee Lead. And City Cancer Challenge Foundation, CCAN support City around the world as the work to improve access of equitability, quality cancer care. And she's a principal investigator of Rebung, which is reducing barrier in cancer early diagnosis in urban B40 group. Let's welcome Professor Noor Aisha for her first talk.
Thank you, Dr. C. So I will be sharing my slides. Can you check for me if the slides are okay?
Okay, Prof.
All right. Are we looking at the speaker's view or the presenter's view?
Should be presenter view, Prof.
Okay, yeah? All right.
Yep.
Okay, thank you very much. I think the whole Rebung team is here today to present some of the work that we've done over the last 3 years. So the first title of the talk today is Creating a Cancer Early Diagnosis Ecosystem. As we have heard, the evidence is adequate to tell that we need to start doing some implementation programs to improve cancer early diagnosis in our community. So Rebung stands for Reducing Cancer Early Diagnosis Barriers in the Urban B40 Group, Rebung in Selangor. So this project has been funded by the Impact Oriented Interdisciplinary Research Grant in 2019, the MPPJ SEED grants in 2020 and 2022, and the International Union Against Cancer, Breast Cancer Early Diagnosis Grant in 2022, and recently the Selangor Health Partnership Initiative or CellHelp 2023. So really how I can try to explain what Rebung is when we actually look at the health complexity framework. So health disparities are characterized by persistent issues surrounding health disparities. And it is actually quite difficult to figure out what to do because these are very complex and dynamic processes, and most of the existing work has been based on approaches that largely ignore the dynamics in the community. So the framework that is built upon is a methodology pluralism. That means you have to have multiple methods, and you have to look into the 3 dimensions of what the complex system patterns show, what are the mechanisms that bring about delayed diagnosis, and you must look at the dynamics of the whole thing. So this paper by Rod et al. In 2023 has succinctly put it into 3 steps about how we can use system-based reorientation of public health intervention research. And how we should be doing this is to address the health inequities by doing these 3 steps. The first one is really to look at the exploratory analysis of population level data. And I think just now Dr. C has presented that, and we know that there is adequate evidence in the population to show that we need to be able to intervene. And the second step is to invest in contextualized, in-depth knowledge of the complex dynamics that produces health inequities in specific population and settings. And the third one is to work with stakeholders at multiple levels to create change within the system itself. So really, this ecosystem is something that we need to study and understand to be able to actually address the issue of delays in cancer diagnosis. So the research questions are many, and I don't want to go into too much details, but what I can tell you is that the objectives of Rebung is a systems approach to cancer early diagnosis in the urban B40 group by really looking into 7 areas, and we have 7 sub-programs in Rebung. These are all the sub-program leaders. I am myself leading the optimal care pathway, how to improve access to cancer early diagnosis. And we have Dr. Lai from Faculty of Arts looking at the social, cultural, religious issues. We have Dr. Lee Yu Kong and now Associate Professor Dr. Nick Daliana from the Social Preventive Medicine, looking into how we can reach these communities. And later on, you will hear from Prof. Hairin on the RakanKu training and on Prof. Suniza now, looking at how we can reach the primary care doctors, and Dr. Chui from our nursing department, looking into how community nurses should be engaged and empowered. And the 7th leader is really on how we can digitalize this process. This work is not, we cannot do this work without this many people, and you can say a whole bunch of people down there, people who treat cancers, who have been involved with all our training modules. So the complex dynamics really looks into who are the providers, who provide social support, financial support, and by looking into these processes and looking at how our stakeholder, the Ministry of Health, how we can actually help them to improve access to equitable cancer early diagnosis. So we've done multiple engagements looking into how care pathways of early diagnosis is done from the klinik kesihatan to diagnostic centers. And in our Petaling Jaya area, there's only one hospital nearby, which is Hospital Shah Alam. And we piloted in klinik kesihatan Taman Medan. So looking into how the resources work, how LPPKN mammograms that are done in a nearby hospital, Beacon Hospital, can be brought into the primary care setting to improve access to the B40 that uses klinik kesihatan. So in the first Rebung 1.0, we have created these multiple tools. Mainly, we will be hearing about them later, 3 of them. And maybe I can share a little bit about the strategic communication campaign that we have done and the optimal care pathway that we have co-created with our friends in the Ministry of Health. So we have a YouTube channel. So if you're interested to look at our training materials and our educational communication tools, you can look into Rebung Cancer. So don't go into Rebung, you'll get all the recipes. Okay, so the first one was our first pilot in Taman Medan, where we had a carnival kesihatan, where we partnered with the masjid to reach the asnaf, or the very poor, who comes for their zakat arrangements. So what happened is that we also had a social media campaign during that period because of COVID, and from our reach, we reached about 7,000 people through WhatsApp. And through the Carnival Kesihatan, we managed to bring about all the cancer NGOs to bring forward together into providing a comprehensive cancer early diagnosis communication campaign during that masjid Carnival Kesihatan. And Rebung 2.0, which just took place on Saturday, we wanted to learn more about the Mandarin B40, Mandarin-speaking B40 community. And what we have is a campaign that took place on Saturday, looking into how people who do not use smartphones, how do we communicate with them? These pilots are meant for learning. We need to learn before we can actually do larger rollouts. So what we have is now, besides our Malay language Rebung videos, you can also look into our Mandarin Rebung videos. So by co-creating this pathway, we have come about with several impacts. So B40 screening in Taman Medan in 2021, before the campaign, was 0. And if you wonder whether it was because of the pandemic, even prior to the pandemic, it was very difficult for KK Taman Medan patients to access mammogram screening. And a lot of people say B40 patients do not want to be screened. but we could see that out of the time that we had to get patients into the mammogram screening from the clinic, which is between June to October 2022, we had 73 women safely accessing the mammogram in Beacon Hospital, and through a patient-centered pathway where the patient didn't have to go to multiple clinics to get their appointments. And then in 2023, we still had women doing their screening mammograms in KK Taman Medan. And if you look at the IFOBT screening in KK Taman Medan, before and after the campaign, you can see almost a triple improvement in the numbers of people actually doing IFOBT. Besides that, the project is also in collaboration with the Greater Petaling City Cancer Challenge, because we understand we can't just be looking into primary care, as well as nurses, as well as doctors, as well as community leaders, but we need to tap into the specialists on how they can improve multidisciplinary team approaches to their care. So certain outputs I could share with you later, as time is very jealous of me, direct translation. We have done a few echo projects this year, and we aim to implement MDTs across hospitals with a proper committee that will form following our next meeting on the 14th and 15th of October. If you are interested in joining the Greater Petaling City Cancer Challenge action plans, please contact me. I will provide you the link to register for the event on the 14th and 15th of October. So what we are aiming for is a digitalized solution, and we are working with Sri Lanka to provide that. And we hope through a comprehensive incremental improvement through our projects and pilot projects, we will be able to provide a complex health intervention to our community. And when we are all living in the area of Selangor, we should be able to benefit from this effort. So with that, thank you very much. I think we are all part of the solution. How do we work together? And I'd like to acknowledge all the doctors, nurses, and all the community leaders from KK Taman Medan, Hospital Shah Alam, the LPPKN clinics, as well as Hospital Beacon, and our new partners for Rebung 2.0, KK Kelana Jaya, the Perker B40 clinics around Kampung Cepaka, as well as Hospital Asunta. So thank you very much. With that, I will stop here, and maybe we can take some questions at the end of the event. Thank you.
Thank you, Prof. Aisha, for your sharing. Yeah. So now I would like to introduce our third speaker, Dr. Suniza. Yeah. Associate Professor Dr. Suniza is our senior lecturer and a consultant oncoplastic breast surgeon in University Malaya Medical Center, as well as Faculty of Medicine. Yeah. So she received her medical degree from University Malaya in 2006. In 2012, she graduated with a Master of Surgery from the University Malaya, and she continued her fellowship training in breast oncoplastic infused center worldwide in Bangkok, Germany, South Korea, and as well as European Institute of Oncology, Milan in 2018. So currently, she has been practicing as a breast oncoplastic surgeon here. So her main fields of interest are in quality improvement of the breast cancer screening program and treatment. And currently, she's actively participate as one of the co-investigator in an ongoing implementation project known as Rebung as well. And today she's going to share with us Rebung Cancer Care in Primary Care Short Course. Dr. Suniza.
Thank you very much to our moderator for very kind introduction. Let me share my slides. And I think everyone can see my slide. Okay. Rebung Cancer Care in Primary Care Short Course is one of the sub-program under Rebung project, and I'm honored to be here to share with you regarding Rebung Cancer Care in Primary Care Short Course. This is basically a new online training aimed to improve cancer care and early diagnosis in Malaysia. And I'm the course director for this. Thank you very much to Prof. Asha to give this, opportunity for me to, to continue this as one of my project. And I would like to thank to all the collaborators, as I stated here, for their tremendous effort and as well as support throughout this course. So for the introduction, let me just tell you what is the most top 10 cancers in Malaysia. As you can see here, the commonest cause of cancer in Malaysia is breast cancer, followed by colorectal cancer, lung cancer, and so on and so forth. You can see from this chart. And I think this have been shared by Prof. C just now, that our patient, most of them, the female breast cancer, the 5-year relative survival rate is still poor, about 66.8%, as compared to developed country like Japan and USA, about 88.9%. And why is this happen? And this is actually our biggest challenge in managing patient with cancer. And this is because of late stage cancer presentation. And what worrying us is Malaysian National Cancer Registry has reported an alarming trends where there's a lot more patient, came with at late stage, at stage 3 and 4. It is increased from 43.1% to 47.9%. It means that what we can understand here is 50% of our patient presented late at stage 3 and stage 4. And this is not only happen in a breast cancer, but it's also similar trend can be seen in colorectal cancer, cervical cancer, and also lung cancer. And why is there a delay? Why is there a delay? I would like to warn you. I will share the next slide. Could be very disturbing for some of you, but these are the reality happen when we see patient in our clinic. You can see most of our patient presented still like this. We are in urban, so-called urban area, Petaling Jaya, but we still see this kind of patient in our clinic. They presented as a fungating tumor. They presented as a bleeding tumor. And this is at least at stage 3 disease. Okay. And why is there a delay? Is it because of the patient delay? And sadly, I would like to tell you that it's also because of the health system delay. And early diagnosis, as defined as timely resolution of diagnosis in patient with symptoms of cancer, as recommended by WHO, is about 60 days, given a better survival outcomes. Early diagnosis improve experience of care, reduce morbidity from cancer treatment. As you know, the higher the stage, the more complex in terms of cancer treatment. And early diagnosis also improve quality of life. Recommended by WHO, early diagnosis is an important cancer control strategy for middle-income countries without organized screening. It's like in Malaysia, we don't have organized screening, we only have an opportunity screening. So because of this issue, because of the late presentation, we developed a training program for general practitioner. Why general practitioner? Because they are the one who close to the community. And we developed a training program for the Malaysia's 5 most prevalent cancers in order to improve their literacy on the cancer screening and early diagnosis. And we also would like to know whether the new online training that we develop, whether it's relevant and effective or not to combat this issue. This is the development phase. The 5 phase of development of this online training. The development team comprised of 30 professionals specialized in cancer care. There were 5 of them, 5 phases of development. The learning objective was developed and a content matrix, as you can see in phase 1, was designed to ensure that the learning objective embedded within each cancer module. We use a Gagnier 9-step model of adult instructional design for the development of the module. And the Kirkpatrick model is basically to evaluate whether this online training is effective or not. Once the module developed, we upload into the open learning platform. And we did 2 pilot testing, one in first pilot last year and another one pilot this year. And we hope that we would be able to roll out to primary care providers in Malaysia. And this is the outline of our care in primary care course. And this is basically, the course is basically self-paced. It takes about 1 to 1.5 hours per week, at any time, anywhere, they can just do the online training. And you can see there will be an introduction how to use the open learning platform. And then at the end of our online training, after they completed the week 1 until week 7, and each week there will be a different type of module, starting from breast cancer and then end up until patient's navigation. As you can see here, the closing is using the live webinar EcoZoom as what we have today. And during this closing webinar, there will be a case discussion and a case presentation by the expert panel, and then case discussion with the participant. The case discussion is whatever the case that they encounter during their practice, and this is very interactive. And the online training there is a lot of things in the online training, is videos, case discussion, quizzes, assessment, and it's very interactive in between the admin or the educator as well as the participant. A survey was administered before and after module in order to test their knowledge about early cancer diagnosis, and also hypothetical changes in practice after each module. And here you can see what we have in as I mentioned earlier. We have 2 pilot. First pilot done last year, January 2022 until March 2022, and our targeted research site is at the Taman Medan, Perka B40, and also Klinik Kesihatan Taman Medan. And you can see we already invited 31 of them, clinic, but only 13 participated, and only 10 completed the course. And the downside, you can see that from this online training, most of them happy to change their practice after the online training. And because of this issue, because of the lack participation from the healthcare provider, we engaged with MMA in order to get a lot more participants. So we did a live webinar actually last year, October last year, with a Dr. Siva from MMA, and we did Are We Doing the Right Screening webinar. And what we found with an engagement with MMA, there is a 600 participant registered, but we only allow 300. That is only the capacity that we can use. And during this engagement with MMA, we introduced this project to all the primary care providers. And what we found in second pilot, we did on the last March until May, and we already completed the training. And the targeted research is at the Perka B40 clinic with postcode 47301, and also we involved the Taman Medan and also KK Klanajaya, and these are the results. Okay, from 10 participants, we managed to get at least 97 participants who is participate in this online training. However, only 69 able to complete the whole course. And you can see on your left-hand side that these are the demographic of our participant, and the median age about 38, and the range is from 28 to 72-year-old. We still have a 72-year-old participant who joined our online training. And there is a predominant female in this among the participant. And also we are quite surprised there is also independent practice doctors who join our online training, which is about 21%. I'm quite surprised as compared to our previous pilot, first pilot. And from this cancer care in primary care short course online, there is the result show there is an improvement in terms of their knowledge from 8 to 12. And also we can see, this is the slide that I would like to show you, that more than 90% of participants would like to change their practice after this online module from week 1 until week 7. And in conclusion, this online training had a very positive impact on cancer knowledge, and because of that, it leads to a high percentage of our participants to change their practice in early diagnosis of cancer. And I would say that the completion rate is a moderate, and of course further research need to be conducted in order to explore how to increase the participation and also how to increase the completion rate in online course for healthcare professionals. I think that is my last slide. I would like to end my presentation with thank you. I pass back the platform to proceed. Thank you very much.
Thank you, Dr. Suniza. Yeah, let me introduce our fourth speaker, Dr. Tree. Yeah, so so Dr. Tree is our senior lecturer with Department of Nursing Science, Faculty of Medicine, University Malaya, Malaysia. So apart from teaching undergrad and postgraduate, she has been involved in curriculum. Can I stop sharing first? Yeah. Yep. Let me introduce the speaker first. Yeah, can see here. So let me introduce our fourth speaker, Dr. Tree Ping Lee, senior lecturer from Department of Nursing Science, Faculty of Medicine, University Malaya. So Dr. Tree, very active in research work apart from teaching undergraduate, postgraduate, and she has been involved in a lot of curriculum development, review, and coordinating Master of Nursing Science program. So currently, her research of interest are cancer care, complementary integrative therapy, issue related to nurses, nursing education, management, and she has published widely in international reference journal. And she has been awarded by University Malaya Excellent Award as her PhD graduate in 2015. So she's going to share with us on UMMC Rebung Community Nurse Competency Program for Women Cancer. Dr. Tree, please.
Okay. Good morning to everyone. Thank you, Prof. C, for the kind introductions. I'm Chui from Nursing Science Department. Okay. As mentioned earlier, the Rebung is an implementation science project that pioneers an ecosystem mapping the care facilities to improve the cancer health promotion and to enhance care pathway for underserved urban community. So the Nurse Competency Program is one of the Rebung tools. We have the Rebung 1.0, the breast cancer short course for community nurses. And this year in Rebung 2.0, we further enhanced the program and become Train the Trainer Community Nurse Competency Program for Women Cancer. The Rebung Train the Trainer Community Nurse Competency Program for Women Cancer consists of 3 modules. Module A is the online breast cancer educator program in collaboration with the Know Your Lemon Foundation. Module B is the 2 weeks of clinical competency program in the hospital. And Module C is online leadership and training skill sharing sessions. In Module A, the online Global Breast Health Educator Program is in collaboration with the Know Your Lemon Foundation. Know Your Lemon Foundation, established in year 2017, is a global charitable organization that has launched an innovative campaign to educate women worldwide about the sign and also the symptom of breast cancer in a unique and also a visual way. The program assists nurses in comprehending the epidemiology, symptoms, and the clinical breast examination and diagnostic care pathway, performing the breast cancer risk assessment to identify women at risk of breast cancer and navigating the path to breast health. As you can see in the slide, these are the lemon, the Know Your Lemon. This Know Your Lemon educational material was developed by Professor Corinne, a designer with a PhD in design thinking for healthcare, with the aim of enhancing breast cancer awareness. It was crafted using design thinking approach, employing the lemons as visual metaphor to symbolize the breast on 12 signs and symptoms of breast cancer. This innovative choice aims to eliminate the stigma around discussing breast health and employ universally accepted design method suitable for the diverse global populations. And this has overcome communication barrier of fears, taboos, and also low literacy. Module B is a competency training attachment in UMMC. A 2 weeks attachment at UMMC include the first week in the Breast Cancer Resource Center and the related clinical area, and followed by the second week in the obstetrics daycare. The community nurses receive the guidance from the experienced breast care nurses in the BCRC, and Sister Suhaida, in the BCRC, and the obstetric daycare nurses. So basically, the learning outcome are to understand the importance of early detection and the treatment for breast and cervical cancer, to implement the clinical breast examination screening correctly, to assist in navigating diagnostic pathway for breast health and breast cancer treatment, and network with cancer NGO and diagnostic center. This with a logbook, attachment to assess their competency in clinical breast examination and breast risk assessment. Module C is the leadership and training skill. This is an online session to strengthening the leadership skill in cancer care health education. And the focus of discussion are the optimal care pathway, a framework for the delivery of consistent, safe, high quality, and also evidence-based care for people with cancer, which covering every step from prevention, the early detection through the recovery. A group of 11 nurses from the Rebung 1.0 and 14 nurses from the Rebung 2.0 from diverse clinical settings has completed the program. The participants are the nurses from the clinic community, the KK Kelana Jaya, the KK Taman Medan, MPPJ clinic from Hospital Shah Alam, LPPKN OUG, LPPKN Shah Alam, Hospital UITM, Hospital KL, Hospital Selayang, Hospital Sungai Buloh, and also Hospital Klang. Okay, on top of this, we have also 4 nurses from UMMC trained under this Rebung Community Nurse Competency Program. This is the Know Your Lemon Impact Map. As you can see here, the map provides a comprehensive overview of the number of individuals worldwide who has been educated. Okay, the pink color is the people, the trainer, the educator by the Global Breast Know Your Lemon Foundation. And all these global breast educators are encouraged to log in periodically to to update the reported number of people they have teach. Okay. And based on our record from the Rebung 1.0, of 5 nurses that have trained, they have done 865 clinical breast examinations and also health teachings. These are some of the photos, okay, in our Rebung project. In Rebung 1.0, we have the leaflet in Bahasa and also in English. Okay, we have participated in this the Majelis Pelancaran campaign Rebung in Taman Medan. We have attended the health exhibition and also health fair during the Hari Bandaraya Petaling Jaya. We involved in the health promotion there in UMMC. And for this year, the Rebung 2.0, we have further enhanced the leaflet. And now we have the Chinese version of leaflet on top of the BM and also the BI. Okay, you can see the pictures. The breast care nurses in the BCRC is in actions, educating the community nurses. And these are photos that we have participated in health campaign at Kampong Cempaka on the 30th of September last week. And we also participated in Pameran Pink October, UMMC. So in summary, the Train the Trainer Community Nurse Competency Program for Women Cancer represent an innovative approach to strengthening the competencies of community nurses. It enhanced scalable early cancer diagnosis partnership framework for breast and also cervical cancer early detection. And these community nurses have played a vital role in creating a community hub with an expanded reach, devoting to enhancing the optimal care pathway for early cancer diagnosis, together with other programs. By employing a peer-based training program model, which fostering the culture of continuous learning, the knowledge sharing, and skill development. Okay, this is the end of my presentations. Thank you very much.
Thank you very much, Dr. Cui. Yep. So I'm going to introduce our next speaker, who is our last speaker for today. Yeah, Associate Professor Dr. Haireen. Yep. So Dr. Haireen is our consultant family. Dr. Haireen is our consultant family medicine based in University Malaya Kuala Lumpur. Yeah. After completed her master of degree in family medicine, so her work is focused on educational matters of undergraduate as well as postgraduate students. Yeah, her interests revolve around lifestyle medicine, especially in combating obesity before this. Yeah, she has implemented a community engagement project and research empowering overweight and obese school children and to fight obesity through a walking football in 16 schools in Petaling Jaya, Selangor before this. Yeah, and she the project have achieved and acknowledged as a flagship award by the Regional Center of Expertise, United Nations University in 2018. Yeah. Congrats to Dr. Haireen. Yep. So currently, she's the course director of a community cancer navigator training under the Impact-Oriented Interdiscipline Research Grant Project or Program, IIRG, called Rebung as well. Yeah. So she's part of the Rebung, and she's going to share with us today on Rebung, the empowering the community in cancer navigation, which is in short, RakanKu. Dr. Haireen, please.
Thank you very much, Prof. C. I'll just share my slides now. Hang on.
So good morning, everyone. I'm going to present my talk on empowering the community in cancer navigation. This is mainly in which is what we call RakanKu, which is the Rakan Pembimbing Cancer Community in Malay, which is the community navigator. So I've got a few people that are working with me. Obviously, my team, my primary investigator, which is like Prof. Aisha, and also Dr. Bay. So overview of the cancer, I think this has been mentioned a few times by the previous speakers. It is the second highest cause of mortality in Malaysia, and 60% of our patients presents late at stages 3 or 4 when they come to see the doctor. And there are multiple challenges, and they are quite complex in terms of cancer care. And obviously it is multifactorial. It can be individuals, and also the problem with our health system, which is very, very complex. So the aim of having a RakanKu is to improve the cancer knowledge literacy and also the navigation literacy through going through our complex health system in cancer care. The impact of cancer is huge, either to both our patients, physically and also mentally, but also to our to the family members that's affected by the cancer, and also our economy. Obviously, when they present late at stages 3 or 4, the treatment is going to be more complicated, and very, it will be more expensive as well. Sorry. Okay. Not quite sure what happened here. Sorry. Sorry, I think I got the wrong presentation. I beg your pardon, but anyway, so as I mentioned, the presentation is late, and this is what happened to our patients when they are diagnosed. They probably don't know what they're going to do, what's going to happen to them, and how to go through the health system. And this is I just borrow a picture from the internet. This is the cancer pathway. It can be very, very daunting, especially to our patients who's not, not aware of how our health system works, what tests to go through, and how they're going to go through the test and how much it costs, and then what happened next when they are going to go for treatment, and what happens during treatment, and some of them might think that this is cancer means death. So it is rather complicated, and it is made more complicated when what's done by our co-researcher, Dr. Lai, when she did the qualitative research with the community, that even before they go to see the doctor, this is what they feel, that cancer is because of their past sins, it's because of black magic. They're quite embarrassed to see a doctor, especially when it involves intimate parts like the breast or cervix, because Rebung involve 4 main cancers, not just the breast. And then it's also a punishment by God, and some of them afraid of being less of a woman when the breast is gone from by operation. So the cancer care continuum evolves, from the prevention, health and prevention, having a healthy lifestyle, to screening, to getting cancer treatment, and also to survivorship or end of life. So there are studies to show that community navigators very important in helping to improve this, to improve the downstage of cancer when they present to the doctor. So success is contingent upon strong collaboration between the community navigators and cancer-related stakeholders, which I'm going to mention later on. So the implementation of this RakanKu project is firstly by choosing the right RakanKu. So who is the right person to be the community navigator by our community, and then how do we train them, and the development of the training module. So if you can see that the RakanKu from Rebung 1.0 and also 2.0, I'm going to amalgamate this into one topic of how we choose the RakanKu. So first, in the Taman Medan, we chose the community leaders, like the Ketua Block or the Ahli Majlis that is involved in the community, because they are based at the community and they are experienced in handling matters of the community. And in Rebung 2.0, we also involve the NGOs as well, either the local NGOs or the cancer NGOs, because they are already in the community doing screening and getting people to go for for screening and treatment as well. So these people are lay persons. Especially the community leaders, they are not medic, they don't have a medical background. Some of the NGOs who are involved to be the RakanKu are also cancer survivors. So they have a little bit of information on cancers, but when we guide them, they do need guidance because they're not doctors. So the training program is very, very crucial before they are allowed to navigate other the community members in their community. So we explain to them the roles of being a community navigator. They need to identify individual needs and barriers to care. And I think from Prof. Aisha's talk just now, they do, they are in the community, so they know that who are suitable for screening, for example. From before Rebung, most of the women who had the mammogram are quite young people because they attend MCH, so they get this clinical breast examination and all that. But the target group who are older, like 50 and above, they don't go to MCH in Klinik Kesihatan, so they don't get to have the clinical breast examination unless the doctor approached them and did it to them. So I'm not saying that they don't do it, but the likelihood of them getting a proper clinical breast examination might be less compared to when they are attending the MCH. So the community navigators also, hopefully, they can ensure timely access to the health and social care services when they are trained on how to access our healthcare system. And part of being the community navigators is also to educate and disseminate information on cancers to patients and to communities. Like what happened during MCO, there are a lot of use of AI and WhatsApp use in the community. So they blast all the information from our YouTube videos, which is part of their training module to the community in thousands, because they have got a lot of WhatsApp group. And from there, they are trained to navigate the individual to existing support, not just to the healthcare system, but also to financial aids that's available either by the government or the NGOs. And so these community navigators are actually a bridge or a link from the community to healthcare facilities, for example, the Klinik Kesihatan and the hospital, and also the governmental financial support. So the training of RakanKu, there are only 3 sessions and it's run over 6 weeks. So it's like once in every fortnight. There are 2 face-to-face sessions. The first one is usually breast, whereby we teach them how to do self-breast examination by using mannequin. And they can actually also teach their friends, their neighbors, or whoever they're in the community, that they can teach how to do self-breast examination. And if they found anything that's suspicious, then they navigate to Klinik Kesihatan to do the CVE. There is one session on online echo platform. This is great because the attendance to online is actually better because it's easy, and the communication is also easy between the RakanKu. All of the sessions will include cancer survivor sharing experience, and I found that the RakanKu are quite engaged when they are sharing of experiences from the survivors, because it is like something real to them rather than something that they heard of in other places. One thing that when we choose the RakanKu, what important is that they have a clear scope of being a navigator, and they must understand and ensure the legal aspects of being a navigator, because of the confidentiality issue that might that they are involved with in terms of patients' medical issues, and how to deal with this and not to tell other people about other the community members' health problems with other people. And it is also not a ticket for them to promote complementary non-regulated medications that, a lot of non-regulated medications available out there. So these are the main things that we actually tell them, and hopefully, it doesn't defer the community members from getting health treatment in the hospital. So the training module of RakanKu involved 14 videos on 5 main cancers in Malaysia, which are the breast, cervical, lung, colorectal, and also prostate, which we included in the Rebung 2.0. There is also a cancer navigation resource document, which has the addresses of the PKB 40 GPs around them, and the specialists who are involved in the treatment of certain cancers, the 5 cancers in Rebung project. And we also include study tour, how to go to clinic kesihatan, because there's several changes that happen after COVID-19, whereby the visit to clinic kesihatan needs to go QMED before this, and now it has changed to MySejahtera. So to teach them how to use MySejahtera, we are surprised that some people don't know how to get access by using this, and they don't go because they don't know how to use MySejahtera. And also to go to Hospital Shah Alam, when to go, what day of certain clinics, like surgical clinic, when it is on, and what time they need to go, and also be involved in physical campaigns. The training module is a standard module, and we, on developing the training module, we include experts in cancers, which was shown by the previous speakers, Dr. Prof. Suniza, and the local healthcare personnel and facilities, the NGOs involved, and also the survivors' experience and sharing that I have mentioned before. So these are the how we train. So we produce the education material, train the trainers, and then there's virtual and physical community campaigns, and we hope the community navigators will be able to do their own campaign, and then how to navigate the community to the clinic kesihatan. If you can see here, our tagline is cam cepat, cek cepat, and ikut cakap pakar and cegah kalau boleh, so that the module is actually in layman's language as much as possible. So from Rebung 1.0, there were 20 participants, which are all female. So in Rebung 2.0, we have included prostate cancer, so because we wanted to encourage more male, so we at least get 2 males in 2.0, which is I think it's a success, right? Is 2 is better than 0. And we use pre and post questionnaires on cancer awareness measure for all 5 cancers: the breast BCAM, bowel cam, cervical cam, lung cam, and prostate cancer. And there is a significant statistical improvement in cancer knowledge and navigation knowledge in breast, bowel, and cervical. So the RakanKu from Rebung 1.0 is still helping the community members to gain access to health facilities, enroll them for screening, and more appropriate group are screened as previously shown. So of course there are challenges in sustainability of this project, especially long-term funding for navigator programs, because the navigators are B40. So we do need some funds for them to help the community members. We need to have a strong relationship with community services and organizations to facilitate and integrate the health and social services, and expansion and succession plans of navigators, because most of our navigators are quite elderly, especially 1.0, who are in 60s, of age. So we need to have succession plans for this. And of course, hopefully, with the Rebung 3.0, we're going to digitalize the training module into Selangor app. So these are the recommendations which I've mentioned before. So in short, so hopefully we can downstage the patients when they present to us. Thank you very much.
Thanks to all the panel of speakers for the sharing with us today with their impactful role to the society. Yeah, with the interest of time, we would like to take 1 or 2 questions from the audience, because now it's already 9 o'clock. Do we have any question from audience? Liana, is the chat box there? Any question? No? Yeah. Okay. So maybe let me ask one question to Prof. Aisha. Yeah. So Prof, with all the project that we have run now from Rebung 1.0 until 3.0, what do you think the most challenge part that you have faced after you have gone through these three versions of Rebung?
Actually, the Rebung 3.0 is supposed to happen next year, not this year. So it's just that we have a long-term plan. I think the most important thing, I think, in any implementation science, that it's not just a one-off, it has to be sustainable. So I think the most challenging thing is really the movement of reality, because we have movements of MOs, movements of specialists. So to actually sustain an optimal care pathway, you need a very strong workforce that is not moving too often. So I would say that the engagement with MOH, I think now with the issues of contract MOs, they're not seeing the light, about how to continue to work in Ministry of Health. So we see a very high turnover of healthcare providers. So I think that's a major challenge. And also the political situation, because when we work with the community, we need to work with community leaders. And whenever there is a change in government, change in leadership, they're not sure whether they're going to continue serving that community. So it's very difficult actually to do a lot of these things during a very unstable period. So I really hope that Malaysia will remain stable for the next 5 years. It doesn't matter who is the leader right now, but it remains stable, so that I think more important work can be done. Because if we let go of this opportunity to create this ecosystem and fund it through different resource, we will be seeing the same thing. And I think I'm retiring soon. I think by the time I retire, I will be seeing the same advanced cancer like what Suniza showed just now.
Yeah.
I saw that as a house officer. I saw that as a specialist. I spent a lot of research time on actually trying to find out why people come late. So I think it's about time we start doing the implementation. And I think by working together, and I'm so happy that our Ministry of Health colleagues are very receptive and very open to collaboration. And hopefully by doing these pilots, we learn about what works, what doesn't. So I think from all the sub-programs, you all know, some things don't work, some things work. And we hope that by all these learnings, when we want to do a proper rollout, it will be more cost effective, because we already know what the issues are, Yeah. So I think that is probably what we all face. I think all the sub-programs face during the pandemic and after the pandemic. Yeah.
Sure. Thanks, Prof. So I guess now it's already 9 o'clock. Yeah, I would like to thank our panel of speakers, Prof. Aisha, Dr. Suniza, Dr. Trey, Prof. Irene, for your sharing today. And we wish you to have a great success for the Cancer Outreach Program. And ladies and gentlemen, this ends this morning session of breakfast at UMHealth. Hope to see you again. Thanks a lot, everybody. Thank you very much.
Thank you, everyone.
Yeah, thanks for sharing.
Thank you. Bye-bye.
Bye.
Great work. Bye.
Bye.